And now from the senator to the former chairman of the Democratic Party and the former governor of Vermont, we'd like to welcome Dr. Howard Dean. Dr. Dean, thanks for being here.
Allison, thanks for having me on.
It can be argued that the bill passed today marks a historic moment for health reform in this country because we rarely, if ever, been this close. How do you see it?
Well, from a process point of view, Senator Schumer's right. You had to get a bill through the Finance Committee, and I thank Max Baucus for getting a bill through the Finance Committee. Having said that, it's not a bill that I'd vote for. It really isn't. This shovels hundreds of millions of dollars of taxpayers' money to insurance companies. There's no cost control in it. So, I think that needs some work. But, it was just tough to get it out of the Finance Committee, and I think we ought to thank the Finance Committee for their hard work. But now the real fight begins. This is not health care reform, the Finance Committee bill. It's insurance reform. I think insurance reform is a good thing, but it's not worth all those hundreds of millions of dollars of taxpayers' money.
You mentioned cost control. Can you describe three components of what you would consider an ideal bill?
Yeah, well, the first thing I'd consider is having people be able to sign up for Medicare if they're under 65. And the reason for that is, first of all, Medicare is very efficient. You can't have it taken away from you. You don't lose it if you lose your job. You can take it anywhere you want in the country. And while its growth is gone too high at 2% above inflation, private insurance growth has gone up at 2.5 times the rate of inflation. There is no cost control in the Senate Finance Committee bill. So, look, I don't want to be a jerk about this. I think President Obama's right. I think these guys worked very, very hard under very difficult circumstances. It is a conservative committee, but now we are at a historic point. We've got to have a good bill. Any bill won't do. Any bill is not a victory. We've got to have a good bill that works and that serves Americans well, and that means give us a choice. It ought not to be up to the Senate whether we get the choice of a public option or not. That should be left up to us to decide for ourselves and our families what's best for us.
What would you say to Senator Olympia Snowe if she were sitting right next to you right now?
I'd say thank you very much. It's about time Republicans and Democrats started working together. This bill is something that thoughtful people ought to be able to support.
It's hard to believe, but it's really been almost a year since the Democrats won the White House convincingly and came to dominate both houses of Congress. Why has it been such a struggle to get the kind of health reform that so many Democrats, especially recognized Democratic leaders, what they want? Well,
I think a lot of insurance companies are very, very powerful lobby. They pour tons of money into campaign coffers. That influences votes. This is a conservative committee. I think Democrats got scared. They got scared in August when the town meetings came up. You got to understand, you got to learn the lessons. We won the majority because we stood up for what we believed was right, not because we tried to become like Republicans. And that's the old Democratic Party. The new Democratic Party has a big majority. We have a president, and we ought to use that majority, because if you don't use your majority on behalf of the American people, you lose that majority. And the reason I mentioned Medicare is we got to have something up and running that some people can get insurance through by 2010. Otherwise, all these myths that the Republicans have been putting out there are going to be circulating around during the election time, and a lot of House members on the Democratic side are going to lose their seat. So we don't have to have the whole bill in place by 2010, but the easiest way to get people insured is to allow some people to sign up for Medicare that are under 65, and that should be done. It's a good program. You do not have to use Medicare rates. I'm with the more conservative Democrats on that one, with Senator Schumer, but you do have to have a bill and let Americans choose whether they're going to be publicly insured or privately insured. That's our choice. That choice ought not to be made by insurance companies, politicians, or demagogues.
We'll have to leave it there for this evening. Governor Howard Dean, thanks for being here.
Thank you.